protocol on the functionality and quality of life in patients with a total knee replacement, a cross-sectional study by Olga, Cecilia Suárez, David Alejandro Escobar, Miguel Ángel Campo, and Magister Leon Alberto Sardi Barona. Um, so osteoarthritis is common in women's and 10% women's and 18% women's from ages from 60 and to 17 age. This is according to the World Health Organization. It produces 80% movement limitation, 25% in difficult activities of daily living, and it changes the population pyramid in Colombia with an increase in the adults. So the problem that was stated is that when that it's going to be studied is total knee replacement. It has high additional international prevalence of non-transferable clinical disease. There is no clinical management guide endorsed by the Ministry of Health and Social Protection in Colombia, and the importance of rehabilitation and early active mobilization protocol, including patient needs and expectations, were found in 2004. The first version was in the 2004, then it was updated to 2013, and then to 2018 is the last actualization. So the objectives for the investigation were, in general, to determine the effect of physiotherapeutic intervention on functionality and quality of life in patients undergoing RTR before and after it. Specific was to characterize the study of the population according to some socio-demographic variables, and to determine the functionality and quality of life related to health before and after the application of the protocol. Also to determine the state of physical condition of the participants throughout the use of validated evaluation tests before and after the application of the protocol. So the type of study was quantitative, prospective and controlled interventional cross-sectional cohort pilot study. The population and sample it was a non-probabilistic sample, international, but including criteria type period from November 2010 to June. It was a 10-person study. The inclusion criteria was medical diagnosis of osteoarthritis of the knee or arthritis, living in Santiago de Cali in Colombia, not having another disease that significantly affects the pain or function. The exclusion criteria was age, I'm sorry, the internet was slow. So I was in the exclusion criteria, and it's from 45 or alter mental status and previous or total and compartmental controllable knee replacement. So there was the methodology was a therapeutic evaluation before and after the surgery, and it was 3 months earlier and after 6 months of the revolution. The tool we used was the WUMA questionnaire, the SF12 questionnaire, and Helsinki Declaration. So the therapeutic evaluation was orthopedic, skin wounds, RX, history of personal work, family, surgical medication, functionality and quality of life needs. So here the needs and expectations of the patients are important for them to organize the rehabilitation that we were supposed to do. Also, the pain was a factor, movement force, flexibility, and measures of length and parameters. So the physiotherapy intervention was an early active mobilization and rehabilitation protocol. It was the introduction was to from 5 to 8 post-surgical days. Um, it was a 3-week therapy session at home for 3 months with approximate duration of 1 hour with no physical media. Different techniques in physiotherapy, core, such as core, pilates, stretching, re-education of preparation, and gait, aquagym, among others.
Que no se aplican medios físicos por la inflamación, por el trauma vascular y de piel
Um,
inicialmente.
Initially, we don't use any medical treatment, physical treatments because of the inflammation, the sore in the muscle,
Inflamación, dolor y trauma vascular.
and the vascular trauma. So the treatment goals were to control the pain and inflammation, to get the early detection of the infection, to gain range of the joint mobility according to the ROM, and recover muscular strength, retrain and gain the proprioception. Uh, the parameters of the rehabilitation was to exercise from the slow speed.
Esto hace la diferencia con los demás protocolos.
And here we found with the studies that here there's a lot of difference from other studies
Porque no se inventaron ejercicios nuevos
because there was no need to invent new exercises
para ganar movimiento, fuerza
to regain movement, strength,
y
and
flexibilidad.
flexibility.
Pero
But
el efecto positivo
the positive effect
ha sido
wa-
cumplir estas reglas.
is that we have accomplished these rules like progressive increasement in repetitions, manual resistance, short lever arms, assisted abscess, removing of gravity, and personalized rating. So the statistic analysis was with Shapiro wheel test on normality
Por ser una muestra pequeña de 10 personas.
because it was a small sample for the study. It was 10 person.
Luego de sacar la normalidad con Shapiro, se hace la distribución paramétrica.
Okay, so after we took the normality from Shapiro test, there were made some parametric distribution where we
Para lo cual se
presented
utiliza
a mean of standard
Más.
deviation.
y desviación estándar. Para la distribución no paramétrica,
And the non-parametric distribution were presented in the
en
median.
median, y se
The,
utiliza eso.
and we used the t-test for independent samples of Wilcoxon test, a AP value of less than 0.05 was considered statistically significant.
Empleando esto para hacer las comparaciones en los momentos de la evaluación.
So we did this during the evaluation to compare the results. So here come the results. In the socio-demographic characterization, we saw that female was the osteoarthritis was more common in female between 60 and 85 years, and the most of the women in this study did not work. So the Umar questionnaire in pain.
Para el dominio de dolor.
So it was seen that when walking on level ground, 5 said that it hurt quite much and very much
Antes de cirugía y a los 6
before the
meses.
surgical and after the surgery. It says 10% said that it was little to known pain.
Lo
When
importante
going downstairs, it was 8 very much before surgery, and after surgery, 8 said that none.
Lo más importante es que a los 6 meses, del 80 al 100% de los participantes
This is important to notice that after 6 months, 80 to 100% of the population in the study
refirieron no tener
referred
dolor
that
o poco
they didn't have any pain or a bit. So the Wilkinson primary
al
test,
comparar
when we combine the
antes y a los 6
pre-surgical
meses.
and after 6 months of surgery, uh,
Tuvo alta significancia
it had
estadística.
a high significance in statistics, showing that it was in the previous results were actually really good.
Bajo eso.
So in the woman in the rigid test, after waking up in the morning, nobody had pain, rigidness, and during the rest of the day, after sitting down, laying down, or resting, nobody had rigidness.
Que normalmente los pacientes antes de cirugía se quejan de mucha rigidez
Okay, it's
al
normal
acostarse
before surgery that every patient will have complaints about rigidness,
o
but
cuando cam-
or when they are walking or sitting down or resting, they will have a lot of rigidness. But after the test, you have none.
siendo la principal causa de la alteración funcional.
This is the principal cause of the alteration, functional alteration,
Calidad de
and
vida.
quality of life. So
Al comparar
when we compared, we saw that there was no statistical change between the 6 months and the pre-surgical rigid. The functionality, so it was that when climbing stairs, going upstairs or going down, uh, on the frequency, there was quite much or very much 7%, and after 6 months, the 8% was none, so it was 100% recovery. The difficulty of bending to pick something up, 100% as well of recovery. And the difficulty of walking on flat ground, it was 6, and the 90% of the population in the studies show no pain after 6 months.
al hacer la
So
comparación
when we did the Wilkinson paramedic test, there was no statistical data found. On the SF12 questionnaire, um, after surgery, they said good, excellent, very good, but we can see that after the surgery, the parametrics.
que el 100% de la población a los 6 meses la califica en estos niveles.
Okay, so after 6 months post-surgical, the almost 100% of the population in the study qualified their living as excellent, very good, and good. And you feel limited to moderate efforts. It was, and they said that after surgery they felt 6% a small amount of limitation, and after surgery they said they had no limitation. So
Que para
so
ir a hacer alguna actividad que tenía programada.
so here was if you had any, you have to stop doing something you already have prepared for the day. So yeah, 8%, 80% of the studies so that yes, they had to stop doing stuff because of the problem. And after surgical, after 6 months, they didn't have any trouble. 6%, 60% of the population, they had no trouble. The next question was if you did less than you would like to do because of an emotional problem, and this is not a much relevance. So 7% said no. If you fell down and sad, or you always almost like never occurred and never affected the studies. So,
Rango de movimiento.
so the joint range of motion for the knee flexion from paramedic.
Para resumirles, la ganancia que se obtuvo en los 3 primeros meses se mantiene para la flexión y la extensión.
So the in resume the gain you get in flexion for the first 3 months, it will has in extension and flexion will be the same.
No hay gran diferencia entre los 3 y los 6
And
meses.
there's not a high difference between 3 and 6 months.
Posiblemente es porque del día,
It is probably
del
because the
día
first
8
from the
hasta
day
los
8
hasta las
from day 8 till
6
from to six
meses
months
se trabaja con el fisioterapeuta
we work with the
esos movimientos.
we work movement with the physiotherapy
3 meses.
in 3 months. So the muscular strength
Para todos los músculos,
for all the muscles,
la nota mejoró
then the quantity was best
a los 3 meses
in 3 months,
y se mantiene a los 6
and
meses
the qualification it will still be higher, or it will be the same in the 6 months.
de 70 al 100%.
It was
los
over from
participantes.
70 to 60% of the participants.
Las-
So the muscle trophism,
esto,
when collecting the different moments of thorpism evolution in the difference less than 1 centimeter.
que normal en los primeros meses no se logra evidenciar por la inflamación postquirúrgica.
Okay, so in the first months of after the surgery is not able to be discovered because of the inflammation of the muscle. So the discussion was that from ages from 68 to 78,
Esta investigación coincide con lo dicho por Bernard,
so this investigation
su estudio.
who is in study,
La edad de los participantes osciló entre 68 y
in his
78.
study, the ages from the participants was from 68 to 78 years old.
Con relación al sexo,
In relationship with the sex of the patients,
coincide
it coincides with the study of Serra Sutton,
quien en 672 pacientes
who in the population of the studies for he was 672 patient, when the 73% were women. And the study of Aguirre
que es un seguimiento a
is
6
a
meses
following of 6 months after the replacement of the knee.
de los 100 pacientes
Af-
con cirugía.
After the 100 patients of surgery,
El
the
rango de edad
average age was 69, and 69% of the study was women.
para woman,
For WOMAC,
eh, esto,
they reported an improvement of the evaluation carried out of 3 to 12 months post-surgery,
que esto fue dicho por Bernard
was said by A. Davies
en su estudio.
in his study.
Y
So,
que Choi
and Jung Jun Choi
concluyó que
concludes that the persistent period of, or for 33% of the population, rigidness of 41, and difficulty claiming SIRS, it will be 54%.
lo cual no coincide con los resultados de nuestra investigación.
So we don't conclude, we don't have the same conclusion for our studies with this, with Jung Ho Shin.
Para el
So
S12,
for the S12 studies, the results obtained do not coincide with the value of the P over 5 and research in the reports by Bernard and Pivek R.
lo cual coincide con lo establecido en el estudio.
So this is similar to the studies.
Para el rango
So for the joint range of motion and tropism, the greatest increase in strength, it was on the first 3 months,
lo cual coincide en algunas partes con los dos autores.
and it's similar between in some parts with both authors, Margaret B. Sachs and Rajesh and Manimar.
Con el estudio de Rajish es necesario aclarar que no se usa la máquina de movilización facial.
So with the Rahish studies, we need to to specify that there's no use of the motion, the continuous passive motion post-totally arthroplasty machine. So the conclusions, by applying the WUMAC, it can be concluded that the patients improve when walking on level ground, after getting up or sitting down, when going to shopping, when removing their stockings or getting out of bed and staying seated. Regarding the health-related quality of life, 100% of the participants stated that they perceived their state of health as good, very good, or excellent after 6 months. The clinical results obtained allowed us to conclude that the parameters such as muscle strength between 80% went from 3 to 3 plus high range, and as well from -4 to 4 range. In the pre and post-surgical tropism, the application of the protocol prevented the presence of tissue arthropathy, and the knee joint range of motion was reached exceeding 90%, 90 degree.
Con relación a la calidad de vida,
Dilo todo.
con relación a la calidad de vida en los primeros 3 meses no manifestaron sentirse bien.
In the first 3 months of life after surgery, in the first months, any increasement of the quality of life, but after 6 months, 100% of the patients said that it was excellent or better.
Antes de finalizar, se está haciendo continuidad de esta investigación.
So this investigation is still being under studies.
Porque somos conscientes
because we're conscious that the population is still really small.
Por eso fue una prueba piloto.
This is why it was a pilot study. Yes. So these are the references we use for the studies. So thank you very much. Are there any?
Thank you for delivering an excellent presentation, doctor.
Que gracias por presentar.
Okay. Any questions regarding Dr. Olga's presentation?